Hello again. If stepping down on your heel brings you pain that stops you in your tracks, you may be suffering from plantar fasciitis, or what is more commonly known as heel spur syndrome. Patients may have extreme pain that never stops. If you or someone you know is diagnosed with this condition, you may be a candidate for an endoscopic surgical procedure, a minimally invasive way to get you back on your feet in a few days. For David Bowman, extreme pain from plantar fasciitis, or what is often called heel spur syndrome, was enough to bring this active father of two to his knees.
The pain in your foot it goes from your heel to your toes, and every step you take is excruciating.
That's how David remembers the pain. He is now 2 weeks out from having an endoscopic plantar fascial release done at Community Regional Medical Center in Fresno.
After the surgery, the only pain I have is from the surgery in the surgery site. That's it, and it's just a healing pain.
What we're going to do is...
Dr. Craig Aronson recommended David have the endoscopic procedure after going through months of treatment but finding no relief. The plantar fascia is a band of tissue running along the base of the foot. In heel spur syndrome, the tissue is inflamed at the point where it attaches to bone. Chronic inflammation can lead to the development of a heel spur over time, but it is not the spur which causes the pain.
I see many people that have a huge heel spur with no pain whatsoever. And conversely, I see people with no heel spur whatsoever that have severe pain. There is no inflammation. Even though a spur is present, there won't be any pain.
The 20-minute outpatient procedure involves a small slit on each side of the patient's heel. Through a canella or small tube, a camera allows the surgeon a view of where the fascia attaches to the bone.
During an endoscopic fasciotomy, the plantar fascia is cut from this ink mark toward me, and the outer 2/3 of the width of the plantar fascia is allowed to remain intact.
The endoscopic surgery has fewer risks and allows for a faster recovery than an open heel surgery. Most patients notice an immediate improvement in the pain and are back to their normal activities within 2 weeks.
A world of difference. You can't even describe it. Going from not being able to walk at all to being able to walk with just that.
Plantar fasciitis is usually caused by improper support or alignment of the foot, which leads to inflammation and pain. Some physical activities and certain medical conditions may also contribute to the problem.
Hi, David. How you doing?
Good.
Because other foot conditions can cause similar pain, it's important a doctor and patient work together to get a correct diagnosis and find a solution.
You need to get a good history and a good feel for what led up to the problem. How have you been getting along?
A lot better.
There are numerous treatments such as stretching exercises, orthotics, anti-inflammatory drugs, physical therapy, and steroid injections, to name a few.
So A, we're trying to get rid of the pain, and B, we're trying to keep it from coming back by addressing the causes of the pain.
Most doctors will have patients try several different treatments simultaneously for a period of time before they recommend surgery.
Surgery is a last resort, particularly with heel spur syndrome. And that's because 90% of the time, heel spur syndrome and plantar fasciitis will resolve without surgery.
After months of treatments and with an injury to his fascia, David's only option was the surgery.
The shots, they say, are supposed to work from 3 to 6 months, and mine lasted less than 2 weeks. So that's when we started noticing that it's a little more serious than getting the shots to relieve the pain. And it was shortly after that it ripped. It just progressed to the point where there was no getting around it.
With stitches out, David is again able to stand and walk on both feet pain-free.
As far as pain-wise, it's nothing compared to what it was. It's nice.
He recommends to anyone having foot or heel pain not to put off going to the doctor. It is very rare for a reoccurrence of the problem, but it can happen even after surgery.